Hi, welcome. This is Dr. John DeMartini. This is one of the most amazing and inspiring shows that you can listen into. If you want to be on the edge of your seats, if you want to open up your heart, if you want to expand your mind, and you want to meet incredible people, stay tuned because you're just about to experience a transformative radio show that will change your life. And you're listening to the Dr. Pat Show that's coming up right next.
Welcome to the Dr. Pat Show. Talk radio to thrive by. Powerful, inspiring, and coming to you live, bringing you stories of people like you and me, busting through and living life full out. Get ready to dare to wonder what your life would be like if you knew you could not fail.
Hey, everybody. Welcome. Welcome. It's so great to have all of you tune us in, turn us on. I'm so excited about these segments that we've been doing now for about a year. And what do they do? Well, first of all, thanks to all of you telling me what you've learned from them, how you possibly have even saved lives. That's why we do it. Today, I have got Dr. Patrick Flume, and I got a fabulous, fabulous person joining us here today. It's going to give you up close and personal, Debbie, about what lung disease is. Today's show, think about this. You know, can summer activities, can they result in exposure to a bacteria? And can that bacteria cause chronic lung conditions? Well, here's what we know. And you've heard me talk about this in terms of myself, my family, a couple of friends recently. This is something everybody should be aware of. Joining me here today, somebody that knows not just about the topic, but lives it, breathes it, studies it, teaches it, and gets the word out. And then Debbie, who is living and breathing and studying and getting the word out. Dr. Flume, Debbie, great to have both of you here.
Great to be here.
Thank you.
So people are like, what? What do you mean? What do you mean exposure to bacteria? Now, you know, the reason I say that is I don't know how much you all know about me. Of course, I'm Dr. Pat, but that's not the only show I do. I was an advocate for Lyme disease like a gazillion years ago. So we do a lot of shows on what people should know about bacteria, what they should know about lung conditions, especially if you live in a place where a lot of this going on. But Dr. Flume, from your perspective, you know, I don't know that I thought I'd be talking to you in this in this year about this, but this is something that is rapidly accelerating.
We are getting a lot of traction, a lot of more patients who are being diagnosed with NTM lung disease. Although it's a rare condition, the incidence is actually increasing. I think that's in large part because there's greater awareness, and so physicians are starting to add that to their differential and considering that in terms of making the diagnosis.
So, Debbie, for you, let me ask you a question.
Yes.
How shocking was this to you and your life?
It was very shocking because it's something I never heard of. So I've had a chronic cough for many, many years, and it probably took 15 years or so before I got the correct diagnosis. I was misdiagnosed with other things. Some doctors thought that there's nothing wrong with me, it's just a cough, but it wasn't just a cough. So then when they told me I have NTM, I said, what's that? And there seemed to be a lack of information. But thank goodness over the years there's been a great deal more. So I'm grateful to have a name put to this condition and have a treatment and feel so much better than I did before.
Oh, yeah, so let's get right into this because right about now, Debbie, people are like, what did she just say she had? Dr. Flume, give us the breakdown. What should people know about this?
So what we're talking about is NTM lung disease. So NTM are nontuberculous mycobacteria. These are bacteria which are actually rather common. They're in the environment, they're in the soil, they're in the water supply. In that sense, we are all being exposed. Some areas of the country, perhaps there's greater exposure than others. Most of us are not going to develop infection. This is still a rare disease, but there are patients who are vulnerable to developing infection. Mm-hmm. And if they get infection and develop NTM lung disease, it can be chronic and progressive and actually quite severe.
So, Dr. Flume, I want to ask you something. about this because I think we have become more aware of what you just said. I think we have become more aware. But I also think that from a very practical perspective, people need to not just be aware, but be aware of the symptoms. So can we talk about those from your perspective, Dr. Flume, and then from you, Debbie, your perspective? Because sometimes they're different, right?
They can vary quite a bit from patient to patient.
Mm-hmm.
And so typical symptoms associated with NTM lung disease are respiratory, and it's a cough, but it's a persistent cough, not a cough for a couple of weeks, but one that persists. Sometimes is productive of sputum. There may be other systemic, non-specific symptoms like low-grade fevers or night sweats, losing weight, or this overwhelming sense of fatigue, kind of like having the flu all the time. And so because these symptoms are non-specific, it's why doctors oftentimes think they could be due to something else. Mm-hmm. It's not always going to be NTM lung disease, but we're trying to get people to consider that in their differential to make that diagnosis, because it's very typical of these patients, as Debbie had suggested, it may take a long time before the diagnosis is made.
Mm. What were your symptoms, Debbie?
So my symptoms were a chronic cough for years. I can think back to when I was in high school, and believe it or not, at that point, smoking was allowed on the school bus. So I'd enter the school bus and start coughing my brains out. And that was kind of my first clue, although I didn't pay much attention. But as I said, I also had sweats, I had fever, and I was diagnosed with pneumonia. And that's what got everybody on the stick kind of working to see what this was. And so many doctors that I had gone to way back when had no idea of this condition. And I was fortunate to find somebody that did. And I am grateful that more and more doctors are learning about it. And we have more communications among patients, too.
Well, can we talk for a minute about the serious nature of it, and then we'll talk about the solution? Because I think that, you know, in the world we live in, we're so busy, right? We're
Yes.
so busy. We're busy, 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 busy. We don't even want to think about it. And we're going to make sure everybody's got a website. So we're busy. We don't want to think about it. So we go into this place of denial. But this is not something that we can fool around with, Debbie, because your life changed.
It did, but as much as you don't like to have a diagnosis like this, because there are all different degrees of NTM, when I speak to people in support groups that I've established, and some of them, the ones who are lucky, were diagnosed early, like me, but there are others that were not diagnosed early, and their condition and their symptoms are much worse than mine. But it can be difficult, but if there's anything I can say about it, it's to be proactive and to stay positive, because that is very, very helpful. Also, there's information out there. I'm not saying to go to any old place on the internet, because that could be non-correct, and it could also be scary. But there's a great website called aboutntm.com, which gives a great deal of information and links to just about any other resource that you're looking for.
Yeah. First of all, let me thank you both for being here, and I think it's great to make sure we're giving out that information, right? I want to ask you, Dr. Flume, a question. Are there situation or conditions, so to speak, that would make people more susceptible? Meaning, does exposure vary based on where you are, what you're doing? Is that a factor?
So there are greater number of cases in certain parts of the country, and these have been associated where there's greater water content. So many of the diagnoses are made in coastal regions, but there are some states that have a greater prevalence, and so the association with water is real. We're all essentially exposed to these bacteria because they're in the soil and the water, but there are patients who are far more vulnerable to developing infection with this organism. And they typically have chronic lung diseases, so chronic obstructive pulmonary disease, COPD, such as emphysema, bronchiectasis, cystic fibrosis, immune deficiencies, chronic aspiration. They've got an environment in their lung that is more suitable for an opportunist like NTM, and they they're more vulnerable to developing infection.
There are a lot of things we could probably talk about today, and I want to talk about a couple things that folks should know about, what they should do. I want to talk about that this is what you should do. But before I do that, I want to mention the website again, about NTM.com, about NTM.com. Lots of information there. There are some things that I think that folks may or may not know about. And what I mean by that is that certainly we're going to find a lot of information out there that you all have provided us with, right? The resources are available. I want to start with you, Debbie. What surprised you most about this?
I think not having heard about it at that point in time, but fortunately, we do have more information, and as I say, that website that you just mentioned is the best place to go.
Thank you. How about you? How about you, Dr. Flume? I want to ask you the question about surprises, but I also want to ask you the question about the vision, the progression of solutions for this. What can we be most hopeful about?
Well, the thing I'm most hopeful about is that the awareness has risen. We're seeing an increase in number of centers dedicating clinics to be focused on NTM. There's a lot more research which is available, and I anticipate that that's going to be the beginning of developing much better opportunities and best practices for the treatment of patients. What I want people to sort of go home with is that just because they have a cough doesn't mean they have NTM, but if symptoms are persisting, they want to make sure they're having the right conversation with their physicians to know if this diagnosis should be on their radar, and then getting the proper testing to get diagnosed.
Wow. I want to thank you both. One last question for each of you. I'd like to know what your personal message is, what you'd like to leave us with today.
I would say be proactive and be positive.
And I would say there's great hope. There's a lot of activity going on, so the future is bright.
All right, website. Give that website again.
aboutntm.com.
Awesome. Thank you both. I'm Dr. Pat. Let's take a short break. This is very, very important, everybody. Please go check out the website. We'll be right back.